All right, so we're going to get into depth on what is ozone therapy used for. These are the indications or the actual diseases and what ozone therapy is working with. It's actually indicated for over 134 different diseases according to the International Scientific Committee of Ozone Therapy. So that's a lot. And again, that's because it's so fundamental in its action. But going back to what I said at the beginning, ozone therapy has 6 primary categories as determined by the market, people like you. And these are the most common reasons that people are doing ozone therapy. Cancer, Lyme, autoimmune disorders, mold toxicity and mycotoxins, infectious diseases, and preventative care / biohacking. These are just some of the common reasons. Dr. Auburn will share a more comprehensive overview of the indications from a practitioner perspective.
So, indications. Ozone treats more than 134 serious illnesses, probably more. Viral infections, bacterial infections, joint pain, inflammatory conditions, circulation conditions, autoimmune diseases, eye diseases, skin disorders, respiratory diseases. Probably should have chronic fatigue on there too, fibromyalgia. And here you have your list of all the different viral infections, bacterial infections. You know, if a person has serious pneumonia, you may also want to put them on an antibiotic. But let's say they come into you and they've already been on 2 antibiotics. You know, or they're very elderly and you're afraid this is going to take them out, you know. This is a great therapy. And you can do it right alongside any other conventional therapy that you decide to do. Just recently I was listening to Mark Hyman on YouTube, and he ended up getting a really bad Clostridium difficile infection and inflammatory. It was like inflammatory bowel disease, you know, 10, 15 bloody diarrhea, bowel movements a day, and ozone just totally handled that. I think he did 2 ozone IVs. And he said the symptoms were gone. So he was convinced. So there are miraculous things like that. Now, I don't present it like that to a patient. I tell them little stories like that. But I tell them, you know, if you're chronically ill, you know, don't expect to get better until you've done somewhere between 15 and 20 of these, 10 minimum. So I prepare them ahead of time, and that's one of the things about using ozone in your practice. I mean, these therapies are not inexpensive. You know, in some areas of the country they charge $200 to $300 for these therapies. But, you know, I just talk to the patient and try to tell them stories and try to get them, you know, thinking with it and understanding how it's working, and share with them that it's really non-toxic. And you know, the worst that can happen is they have like a Herxheimer reaction, which does occur, you know, not in everybody, mostly everybody I should say it does not. It actually happened to one of my staff who had an acute bronchitis, but you know what, she got half of the ozone IV in, we stopped it at, you know, that, and she still benefited from it. She just felt a little funny pain in her chest and short of breath, but that's rare. It's very, very rare to have something like that happen. Joint pain, just a little plug here for Prolozone. I do all kinds of regenerative injections at my clinic. I do the Prolozone, which is where you do prolotherapy and then also put ozone in there. Some docs just do high-dose ozone after they've numbed the joint with just ozone. Just the ozone gas, and I also will use it in my PRP patients if I have a really bad knee and you know, they don't want to go with stem cells. We try PRP with ozone. And just to answer any questions that might be out there, I do not combine my ozone with my PRP. My PRP is prepared with some ozone, but if they're paying for additional ozone, I just charge them $75 extra. And I just inject it separately after the joint has been injected or the tissue has been injected. So also inflammatory conditions, again, these are, some of them are duplicated pneumonia, fibrosis, fibrositis. This is your fibromyalgia, bursitis, nephritis, iritis, uveitis, cholecystitis, pancreatitis. Circulation conditions. Remember, we discussed about how the rheology, the flow of the blood is improved by ozone. Heart conditions, peripheral vascular disease, gangrene, You're not just doing it for the infection, you're doing it for increasing the blood flow, vascular headaches, deep vein thrombosis, claudication, diabetic ulcers, thrombophlebitis, your autoimmune diseases. We've already mentioned quite a bit of these. Multiple sclerosis is on this list as well, even allergies and rashes. And yeah, reminds me, I've had pretty bad poison ivy the last couple of weeks. It's dissipating, but I'm going to go get an ozone IV now. Going to get 2 or 3 of them, see if I can get rid of the last little bit of it. Other conditions, fungal and yeast infections, we do a lot of candida treatment at our office, so definitely helpful for that. As I mentioned earlier, the viruses were listed earlier, but I had that patient with EBV that, it got reignited with post-COVID symptoms, and ozone handled that beautifully with 5 treatments. Tetanus, chronic fatigue, all of these have been studied. Eye diseases, retinitis pigmentosa, I think we have a slide on that by some of the researchers in Cuba. Optic nerve dysfunction, glaucoma, keratitis, macular degeneration, skin disorders, psoriasis, non-healing wounds, severe acne, recurrent skin infections, respiratory diseases. These are, it's fantastic for these. I have a COPD patient who is now, gosh, I think Elaine is 92. And she is still doing monthly ozone IVs after doing a series of like 20 of them at 1 to 2 a week. And she's pretty spunky. She does also have congestive heart failure, so she's definitely slowing down, but it has really slowed that process down. And she's, other than being hard of hearing, she has had fantastic improvement and stabilization, and it has able to continue into her 90s gracefully in better health. Sinusitis, bronchitis, tuberculosis, often with the sinusitis, we'll also have them get ear and nasal insufflation while they're getting their ozone IV or afterward. So also we have listed here all of these conditions which are pretty much already listed, except for I don't know if ulcerative colitis was listed there, but you can also do rectal ozone for ulcerative colitis. If they're bleeding a lot, you may have to start with very low doses, like 100 cc's maybe, and do that for 3 to 5 days a week for a couple weeks before you go to 200 cc's or more. But IV, if they're just too sick to do the rectal ozone, it's just a cheaper way for them, and then they have the ozone machine. IV ozone is fantastic. You're definitely always going to get better, faster results with the IVs. Also preconditioning, for athletes. If you have athletes that you take care of, or if you're a doctor who handles, elite athletes, whether that's college level or professional level, ozone is definitely a safe and effective and totally acceptable way. It's not illegal in the sports world to do ozone. You're just increasing their oxygen utilization. Also, my ozone sauna, I have the Hocket ozone sauna, which has many modalities in it. It's got ozone, but it also has electrotherapy and aromatherapy, and there's also carbon dioxide mixed with the steam, and the heat makes carbonic acid and increases their circulation and dilates the blood vessels, and it increases what's called the Bohr effect, BOHR, to help them drop off more of the ozone that's going through the skin, through the pores, and getting into the body, and it helps it drop it off in the tissues. I love my Hocket sauna. And it's a great delivery system too. But again, the IV ozone, especially if you have a really sick patient, is going to be, more oxygen utilization improvement. But some of my patients who are athletes or who have, a knee replacement surgery they're recovering from or something like that, or even with knee arthritis, they do the sauna. And there are cups in the sauna with an accessory tube, so we can do breast cupping, or we can just put that ozone over the knees if the knees are bad, or the shoulder if the shoulder's bad, and you get more direct delivery right there. But IV ozone is going to get them more. So it's nice to have lots of modalities because different people want different things. Some people are afraid of needles, so if they're not as sick, you know, you can do these other modalities. Macular degeneration and MAH, it's good for both wet and dry forms. It will stop progression in 100% of patients that were tested in Cuba. It will improve acuity in 60 to 70%. MAH, you start with 50 cc's at 1 to 2 times a week and work up to 200 cc's. That's the way we do it. If the person's really, really healthy, you could start at a higher dose. If they're really sickly, you want to start at a lower dose because, you know, it's a little bit of a stress on the body and you don't want them to have a major Herxheimer reaction. If it's something acute, I just do the 200 cc's. Anyways, you monitor the visual acuity weekly, or in this study they did, and the results will be seen after 14 to 20 treatments. This is Riva Sanseverino. I'm not sure if I'm saying that. Sanseverino, I think. She did ozone IV therapy on age-related degenerative retinal maculopathy. The effects of the oxygen ozone therapy. In Europe, they often call it oxygen ozone therapy. If you guys don't know, when you make ozone, about 97 to 98% of it is oxygen, and then 2 to 3% of it is ozone. But even that small percentage of the ozone in what you're making in that gas, that's what does the work. So in Europe, they often refer to it as oxygen ozone therapy. So continuing with the quote, the effects of oxygen ozone therapy on 20 patients affected by age-related degenerative maculopathy have been studied. Visual acuity and eye fluorangiography were the parameters used in order to evaluate the efficacy of the therapy. Medical ozone was administered intravenously according to the technique called ozonized major autohemoinfusion, or major autohemotherapy. We call it MAH for short. The total amount of ozone ranging from 1,500 to 200 micrograms per session for a 4 months period. And the results have indicated that the majority of patients showed an improvement of their ocular condition, suggesting continuation of this type of investigation on a larger group of people. And just so you guys understand, when you make ozone, it's in micrograms per cc. So if you draw up a cc of ozone, you're drawing up in that syringe, like say 10 cc's, or let's say it's 20 cc's. So if you set the ozone generator for say 45 micrograms per cc, and you have 20 cc's in there, 45 times 20 is the amount of ozone you're getting. So 45 times 20 is 900 micrograms. Now also don't get confused because some of the terminology is gamma, and the gamma means micrograms per cc. So you'll see it referred to in the literature as, you know, 1500 gamma or 1500 micrograms per cc. Actually, you would never drop that amount of ozone for the generator. The ozone generator, the most it's going to go up to is maybe 60 or 70 micrograms per cc. I will tell you, at my clinic, all of the IV ozone, we always use 45 microgram per cc ozone. So 45 micrograms per cc, and we work the patients usually up to 200 cc's for most things. And so 200 times 45 micrograms per cc, they're getting 9,000 micrograms of ozone. So, and in this study, you can see here 1,500 to 2,000 micrograms per session. That's a quarter of what I do in my patients once I work them up to that dose. And most people can handle that. They can handle a lot. So, but the sicker the patient is, the guideline is start, you know, like at 50 cc's of that 45 microgram per cc and go up by 50 cc's every treatment until you get them up to 200. That's what Schallenberger taught me. Basically, that's what Tom Lois taught me. I have found, though, most people can tolerate it well, and often I just, especially if they have an acute illness, I'll skip to 100 or 150 cc's to get it in there right away. And if they're really healthy, I'll just go with the 200 cc's. Again, Riva Sanseverino study, MAH once a week for 14 weeks, visual acuity after 1 month for the dry macular degeneration, 44% improved, 5.5% were worse, and 50% had no change. For the wet macular degeneration, 100% no change. For visual acuity after 4 months, there was some improvement in the wet macular degeneration. The dry macular degeneration, 38% improved, 5.5% were worse, 55% no change. But it did stop the progression, so that's good to know. No change. And no change also in the wet group. They had 13% improved. So the more they did it, the more the difficult cases, the wet macular degeneration improved, and then 18% were worse, 68% no change. So there was some worsening in some of these cases, so I shouldn't say it, arrested all of their progression, but what were these other patients doing? Could they have done better? Was their disease in a bad state before they started? What other therapies were they doing? But nonetheless, I mean, other than doing injections into the eye of, I believe it's Avastin, what else are you going to do? If this could improve it. Also, some of my patients do chelation therapy, because macular degeneration is a disease of the vessels in the back of the eye. So, there is a form of IV ozone called Keyzone, and that's a good point to make clinically. Whenever you want to do another therapy on the same day, do the ozone first. Because when you do IV ozone, major autohemotherapy, or any ozone therapy, whether it's a sauna or ear insufflation or whatever, that effect is really immediate. You just start that cascade rolling and then it continues. So that effect is already taking place. So literally, you can, right after you do an IV ozone, you can also do vitamin C, you could do a Myers cocktail, you could do a GABI IV push, you could do IV glutathione, you can do any kind of nutritional IV, you could do chelation, and that's really what Keyzone is it's IV ozone followed by IV chelation. You just unplug one, plug in the other, and that's called Keyzone. And for those really bad vascular cases, that's what we do, and I would possibly do that for a macular degeneration case if they were really, really bad, and it might increase the effectiveness rate. So just remember, anytime you're doing any other IVs on the same day, and that would include like Plaquex, any, that's phosphatidylcholine intravenously, any of those other IVs, do them after you've done the IV ozone. So in final conclusion on Riva's study here, the numbers were identical for floor angiography, a method for looking at visual fields. So she showed that MAH once a week for 14 weeks did make a difference.